Good afternoon, and thank you for inviting me to speak at your 2022 Hill Day. I'm Congresswoman Bonnie Watson Coleman, and I represent New Jersey's 12th Congressional District. Since my first days in Congress, I've been an advocate for expanding access to affordable quality health care. We're in the third year of a pandemic that has brought about widespread isolation, uncertainty, and suffering. It is more important than ever for us to address the real and lasting effects that these challenging times have had on our mental health. However, it should not take a once-in-a-generation crisis for us to acknowledge the importance of access to comprehensive health care and specifically mental health services. Many Americans' mental health struggles start at a very young age. Youth mental health has been on a rapid decline since the decade leading up to the pandemic. The Surgeon General's office reports that between 2009 and 2019, the share of high school students reporting persistent sadness or hopelessness increased by 40%, while the share of those contemplating suicide increased by a heartbreaking 36%. Like so many other crises, the youth mental health crisis disproportionately affects Black and Brown youth. In 2019, I launched the Emergency Taskforce on Black youth suicide and mental health. And our report found alarming increases in suicide rates among Black youth, in part due to racial disparities in access to essential mental health care. The task force findings and the report that followed inspired me to introduce Pursuing Equity in Mental Health Act. My bill would make long-overdue investments in culturally competent mental health services, increasing funding for fellowships and direct research and resources at federal departments and agencies. I am also working to eliminate racial mental health care gaps through my Black Mental Health Brain Trust. Earlier this year, I established this coalition to connect mental health researchers, practitioners, and advocates. Through our combined efforts, we can create a united front toward creating a mental health crisis care system that works for all. Of course, fighting America's mental health crisis wouldn't be possible without organizations like Mental Health America. So I'm grateful for everything you do, from connecting people with care providers to providing free support resources for those who are struggling. I'm honored to be here to kick off your Hill Day. I hope you'll remind your representatives and senators to take mental health seriously. We're only in Congress because people like you voted for us. So hold us accountable. It's our duty to listen to you and represent you. Thank you.